What will living with COVID mean when coronavirus restrictions end in England? Sky News looks at how the laws on COVID are being scrapped in England and speaks to public health and employment experts about what that will mean for people day-to-day lives. Since the first lockdown almost 2 years ago, the lives of people in the UK have been dictated by the laws on coronavirus. But this week, the government is scrapping the last remaining COVID restrictions in England and replacing them with the Living with COVID plan. It will mean that people will no longer be breaking the law if they do not self-isolate it when they have the virus, and access to free tests will be considerably reduced. PM News Conference confirmed follow live coronavirus updates. Although the changes only apply to England, the devolved nation are expected to reveal their own living with COVID strategies in the upcoming days. While Downing Street officials says the vaccine rollout means government interventions in people's lives can now finally end. Scientists and NHS leaders say the decision is too far premature and will put people at unnecessary risk. Here Sky News looks at how the laws on COVID are being scrapped in England and speaks to public health and employment experts about what that will mean for people's day-to-day lives. What is changing? Self-isolation. As has been widely reported, the law around self-isolation when you have coronavirus will be scrapped and be replaced by guidance to stay at home and away from vulnerable people. From 24 February, people who test positive for COVID will no longer be bound by law to self-isolate. Adults and children who have the virus will be advised to self-isolate, but this would not be a legal requirement. Vaccinated contacts of people who have tested positive will no longer be asked to do daily lateral flow tests for 7 days. Contact tracing will end. Spot payments for people who would have previously self-isolated with COVID will end. Businesses will no longer be legally required to tell staff to they are isolated if they have COVID. Testing. England's testing program is being significantly wound down, with the government saying it is switching from widespread testing to surveillance and monitoring of coronavirus in England. From 21st February, staff and students in school and college will no longer be advised to do twice weekly lateral flow tests. People will only be able to order packs of lateral flow tests from the government website every 3 days. From 1st April, free universal testing for people with or without symptoms will end and be targeted more towards vulnerable groups.